All right, let's get into chapter 20, gastrointestinal and urologic emergencies. Applies fundamental knowledge to provide basic and advanced emergency care and transportation based on assessment findings of an acute ill person. Anatomy, presentation, management of shock associated with abdominal emergency, gastrointestinal bleeding. Anatomy, physiology, pathophysiology, assessment and management of acute and chronic gastrointestinal hemorrhage, peritonitis, ulcerative diseases. The blood pressure assessment in hemodialysis patients, anatomy, physiology, pathophysiology, assessment, management of complications related to renal dialysis, urinary catheter management, not insertion of it, and kidney stones. So, abdominal pain is a common complaint. The cause is often difficult to identify. You do not need to determine the exact cause of acute abdominal pain. You should be able to recognize any life-threatening problem and act swiftly in response. The abdominal cavity contains solid and hollow organs that make up the GI, genital, and urinary systems. Solid organs are your liver, spleen, pancreas, kidneys, and ovaries. Injury to a solid organ can cause shock and bleeding. Gastrointestinal system's main function is to absorb the products of digestion to fuels the cells within the body. So its main function is to digest and convert that into fuel for the rest of the body. Consists of the mouth, intestines, salivary glands, pharynx, esophagus, liver, gallbladder, pancreas, rectum, and anus. The entire digestion process takes 8 to 72 hours. The salivary glands secrete saliva to help lubricate the food. Once swallowed, food moves along through the esophagus, pushes the food along using rhythmic contractions called peristalsis. Cardiac sphincter is designed to prevent food from backing up into the esophagus. Veins around the esophagus, then in combination with others, form the portal vein. Transports venous blood from the GI tract directly to the liver for processing nutrients. If blood flow through the liver slows, blood may back up into the entire GI. So the stomach secretes hydrochloric acid to break down the food. It also absorbs water, alcohol, and caffeine. The liver secretes bile and filled with toxic substances, creates glucose stores, and produces substances for blood clotting and immune function. The small intestine is the first part. The duodenum is the first part of the small intestine. It absorbs resources for use by other cells in the body. Well, active stage of the duodenum is where the active stage of absorption begins. It's also where the pancreas, liver, and gallbladder connect to the digestive system. The exocrine portion of the pancreas secretes enzymes into the duodenum that assist with digestion of fats, proteins, and carbohydrates. Pancreas also provides bicarbonate insulin. The small intestine produces enzymes that turn chyme into substances that can be absorbed by the capillaries of the small intestine. The jejunum comprises of a large amount of the surface area of the small intestine and does much of the work. The ileum, the final part of the small intestine, absorbs nutrients that were not absorbed earlier and absorbs bile acids. Also vitamin B12. The larger intestine to include the colon, substances not broken down into the colon, has water products or feces. The primary role is to complete the reabsorption of water and solidify the digested material. The side of bacterial digestion helps finish down the breakdown of chyme, produces gas as a byproduct. Attached to the last portion of the colon is the rectum. Colon terminates at the anus, where feces are expelled from the body. So now you know how your gas is produced. Additional abdominal organs, the spleen has no digestive system function. It's part of the lymphatic system, assists in the filtration of blood, aids in the development of red blood cells, and serves as a blood reservoir. Produces antibodies to help the body fight off disease and infection. But when that thing gets infected, it's a hurt and something like that. Alright, the male reproductive system, you got your testes, your epididymis, your vasa differentiae, and this is the part of the male reproductive system on the right, and the female reproductive system on the left. The urinary system consists of the kidneys, the urinary bladder, uterus, and urethra. There's a part of the male reproductive urinary system. The two main functions to regulate electrolytes, water content, acids in the blood. It also removes metabolic waste, drug metabolites, and excess fluids. Kidneys perform these functions continuously, filling 200 liters of blood a day. A lot of blood. The kidneys also produce hormones that generate new red blood cells and help the liver convert glycogen into glucose. Nephrons found in the cortex are the structural and functional units of the kidney that form urine. They play a major role in maintaining homeostasis and eliminate metabolic waste products from the blood. Alright, the acute abdomen refers to the sudden onset of abdominal pain that indicates an irritation of the peritoneum, peritonitis. And peritonitis can be caused by infection, trauma, and many diseases. Severe pain in the major system. Clinical signs are abdominal tenderness and distension. It consists of two membranes. The parietal peritoneum lines the walls of the abdominal cavity, supplied by the same nerves from the spinal cord that supply the skin overlying the abdomen, and it can perceive the sensations of pain, touch, pressure, heat, and cold. Visceral peritoneum covers the surface of each of the organs in the abdominal cavity, supplied by the autonomic nervous system. It is stimulated when distension or contraction of the hollow organ activates the stretch receptors. Refer pain is painful sensations that occur because of an irritated visceral peritoneum. It may be perceived at a distant point on the surface of the body, such as the back of the shoulder. It results in the connections between the body's two separate nervous systems. So in this picture, you can see where the gallbladder may be inflamed, and it connects to the spinal cord, and it has a snap point at the right shoulder. Peritonitis typically lines ileus. It may cause vomiting associated with loss of fluids in the abdominal cavity, potentially causing hypovolemic shock. Patients may have normal vital signs or signs of shock. Fever may or may not be present and may be seen in patients with diverticulitis or cholelithitis. Patients with acute appendicitis may have normal temperature until the appendix rupture and an abscess starts to form. Disease and conditions of the renal and urologic system range from urinary tract infection to acute kidney injury. So this chart is going to show. So any condition that allows foreign materials into the abdominal cavity can result in peritonitis and acute abdomen. Nearly every kind of abdomen problem can cause acute abdomen. Any condition that allows pus, blood, feces, urine, gastric juice, intestinal contents, bowel, pancreatic juice, intestinal contents, or other foreign materials to accumulate within or adjacent to the abdominal cavity can cause peritonitis or acute abdomen. The retroperitoneal organs can also lead to acute abdomen, and nearly every kind of abdominal problem can cause acute abdomen problem. Bleeding within the GI tract is a symptom of another disease. It can be acute or chronic. All complaints of bleeding should be considered serious. It can occur in the upper or lower GI tract. In the esophagus, bleeding conditions might stem from esophagitis, esophageal varices, or a mallory west tear. Hematemesis is frequently seen in patients with upper GI bleeding. Common causes of the bleeding in the lower GI tract include bowel inflammation, diverticulitis, cancer, and hemorrhoids. The esophagitis is inflammation of the esophagus. It's caused by infection process or by reflux of the gastric secretions in the esophagus. It can be caused by medications, chemotherapy, or radiation therapy. The effects are irritation and swelling. Patients will present with either heartburn or choking as their primary complaint. Most commonly occurs in patients with gastroesophageal reflux disease, or GERD. So GERD is the sphincter between the esophagus and the stomach opens, allows stomach acid to remove superiorly. Also referred to as acid reflux disease, can cause a burning sensation within the chest. Smoking, obesity, and pregnancy increases the chances of GERD. If the reflux continues over a long period, damage can occur in the esophageal wall. Could result in leaking portions that are more susceptible to bleeding. Heartburn is the predominant clinical finding for this condition. Pain may be increased with positional changes. Some patients may experience coughing or have difficulty swallowing, and bleeding can occur if the damage is long-term, resulting in bleeding. Peptic disease and gastritis. The stomach and duodenum are subject to high levels of acidity. High levels of acidity can result in ulcers. So to prevent damage, protective layers of mucus line both organs. In peptic ulcer disease, the protective layer erodes, allowing acid to eat into the organ. Gastritis is caused by the same imbalance between stomach acid and protective layers. Pre-ulcerative state in which the stomach is inflamed, but erosions have not yet occurred. And these peptic ulcer diseases are usually the result of pylori, chronic use of non-steroidal anti-inflammatory drugs, alcohol, and smoke. It can affect men and women equally, but occurs more frequently in older age groups. Foodborne infections and food allergies can also cause inflammation. Patients experience a burning or gnawing pain in the stomach. Sometimes it subsides and diminishes after eating and then reemerges 2 to 3 hours later. It usually presents in the upper abdomen. Nausea, vomiting, belching, and heartburn are common. Some ulcers heal without intervention. Complications can occur from bleeding and perforation. Mallory west tear is a tear in the junction between the esophagus and the stomach, causes severe bleeding and potentially death. Primary risk factors are alcoholism, eating disorders, can have a sudden onset and affect people of any age. Vomiting is the primary symptom. In women, this may be associated with severe vomiting related to pregnancy. The extent of bleeding can range from very mild to severe. So they may experience signs and symptoms of shock, upper abdominal pain, hematemesis, and malignancy. Brewer-Have syndrome also occurs during vomiting. Esophagus tears longitudinally, and the tail travels entirely through the wall of the esophagus. Occurs more often in men and presents after a large meal that includes alcohol consumption. Esophageal varices occurs when the amount of pressure in the blood vessels surrounding the esophagus increases. When the blood is blocked up in the portal vessels, but the vessels dilate, causing the capillary network of the esophagus to begin leaking. If pressure continues to build, the vessel's walls may fail, causing massive upper GI bleeding and hematemesis. In industrialized countries, alcohol is the main cause of portal hypertension. The presentation may take two forms. Initially, the patient shows signs of liver disease, fatigue, weight loss, jaundice, anorexia, edema in the abdomen pain. A gradual disease process can take months to years for the patient to feel extreme discomfort. The second presentation, ruptures of varices, is more sudden onset of discomfort in the epigastric region or sternum. Severe difficulty swallowing, involvement of bright red blood, hypertension, signs of shock, and damage to the vessels can be life. Alright, hemorrhoids created by swelling inflammation of blood vessels around the rectum may result in conditions that increase the pressure on the rectum, often result in bright red blood during defecation, and patients may also experience itching and a small mass on the rectum. Gallstones the gallbladder stores digested juices and waste from the liver. It can form and block the outlet from the gallbladder, causing pain. If the blockage does not pass, it can lead to severe inflammation of the gallbladder called cholecystitis. The gallbladder can rupture in several cases and presents as a constant severe pain in the right upper mid-abdomen region and may refer to the right upper back, flank, or shoulder. Pain may steadily increase for hours or come and go. Symptoms commonly appear 30 minutes after a particularly fatty meal and usually at night. So some symptoms are general GI distress, nausea, vomiting, indigestion, blood, gas, and thirst. Pancreatitis caused by obstructive gallstone, alcohol abuse, or other diseases. Severe pain in upper right and upper left and right quadrants, often radiating to the back. Nausea, vomiting, abdominal distension, tenderness, sepsis, or hemorrhage may occur. Appendicitis is a frequent cause of acute abdomen. It can cause an abscess, peritonitis, or shock. Pain is initially more generalized, dull, and diffuse, and may center around in the umbilical area. Pain later localizes to the right lower quadrant and may cause referred pain. Nausea, vomiting, anorexia, double chills, rebound tenderness. Women who are pregnant may not exhibit this symptom. Gastroenteritis caused by a bacterial viral organism, typically via contaminated food or water. Patients may begin to experience an upset stomach and diarrhea soon, several hours or several days after contact with the contaminated matter. The disease can run its course in 2 to 3 days or continue for several weeks. It may also be caused by non-infectious conditions such as adverse reactions to medications, exposure to certain toxins, or chemotherapy. Symptoms include large dumping diarrhea or frequent small liquid stools, diarrhea containing blood or pus, abdominal cramp, and nausea, vomiting, fever, and anorexia or dehydration. Diverticulitis was first recognized in the 1900s when the foods people ate changed dramatically. As the amount of fiber consumed decreases, consistency of stools became more sour, requiring more intestinal contractions, increasing pressure in the colon. Diverticulitis bulges in the colonic walls result from increased intestinal contractions, eventually turning to passage called diverticula. Fecal matter is caught in the bulges, and bacteria form, causing localized inflammation and infection. The main symptoms of abdominal pain usually on the left side of the lower abdomen. Classic signs include fever and malaise, body aches, chills, nausea, vomiting, bleeding is rare. Adhesions may develop near the diameter of the colon. It results in constipation, bowel obstruction. And in severe cases, these infected outcroppings may burst, causing proliferation of the affected segment of the colon. Ulcerative colitis is caused by inflammation of the colon. The inflammation is generalized, affecting the inner lining of the intestine. Cause cause of the inflammation is unclear. Genetic stress, autoimmunity have been speculated to be responsible. Inflammation causes a thinning of intestinal wall, resulting in a breaking dilated rectum. There are approximately 238 per 100,000 people who have ulcerative colitis. Occurs more often in men than in women, and strong family history component. So, signs and symptoms: gradual onset of bloody diarrhea, mild to severe abdominal pain, joint pain, and skin lesions, fever, fatigue, and loss of appetite. Irritable bowel syndrome: patients who have abdominal pain and changes in the bowel habits. Three main factors observed in patients: hypersensitivity of the bowel receptors, responsiveness of the smooth muscle in the bowel. It does have a psychiatric disorder connection in IBS. These problems usually typically begin during childhood. So once diagnosed, is that patients have pain at least 3 days per month for at least 3 months. So the pathology of the disease is unclear. All right, Crohn's disease can involve the GI tract from mouth to anus. It's similar to ulcerative colitis, but the part of the GI tract to be affected is the ileum. No definitive cause has been identified. It affects 201 adults per 100,000 population. All right. Pathophysiology of the urinary system. Conditions range from urinary tract infections to acute renal failure. Pre-hospital care is usually supportive. So, usually developing UTIs is a bladder inflammation or cystitis. It's usually developed in the lower urinary tract, the urethra, or bladder, when bacteria enter the urethra and grow. So, it's more common in women. UTI usually occurs in upper urinary tract, and most often with a lower UTI goes untreated. Upper UTIs can lead to abscesses, eventually reduces kidney function, and in severe cases and more commonly in the elderly, untreated UTIs can lead to common problems with UTI is praying for urination, frequent urges to urinate, difficulty in urination. Pain usually begins as visceral discomfort, becomes extreme burning pain, especially during urination, remains localized in the pelvis and perceived as bladder pain in women, and prostate pain in men. Sometimes pain is referred to the shoulder or neck, and urine will have a foul odor and may appear. Kidney stones originate in the renal pelvis, results from excess of insoluble salts or uric acid that crystallizes in the urine. Calcium stones are the most common, occur more frequently in men, and may have hereditary components. Also occur in patients with metabolic disorders such as gout or hormonal disorders. People with kidney stones are almost always in severe pain. Pain usually starts as a vague discomfort in the flank, but becomes very intense within 30 to 60 minutes. It may migrate forward or toward the groin as the stone passes through the system. Some patients will be agitated and restless as they walk or move in an attempt to relieve the pain. Others will attempt to remain motionless, and guard their abdomen. Vital signs vary depending on the severity of the pain. If a stone has become dislodged in the lower part of the ureter, signs and symptoms of UTI may be present, but the patient will not have a fever. Kidney disease may be categorized as either acute or chronic. In the U.S., the prevalence of chronic kidney disease is approximately 14%. So, two leading causes are high blood pressure and uncontrolled diabetes. All right, acute kidney injury is a sudden decrease in the kidney filtration, increased toxins in the blood, often reversible if promptly diagnosed and treated. Oliguria is urine outlet less than 500 mLs per day. Anuria is cessation of urine production. Patient may experience generalized edema as to build up in high levels of waste products in the blood. If left untreated, heart failure, hypertension, and metabolic acidosis could occur. Chronic kidney disease, progressive and irreversible inadequate kidney function resulting in permanent loss of nephrons. It develops over months and years, often caused by systemic diseases such as diabetes and hypertension. It can also be caused by congenital disorders or prolonged secondary effect of some infections, including strep throat. As the nephrons in the kidney become damaged and cease to function, waste products and fluid build up in the blood. Systemic complications could be hypertension, CHF, anemia, and electrolyte. Signs and symptoms are altered LOC, seizures, coma, lethargy, nausea, headaches, cramps, signs of anemia. That uremic frost you may see also on patients, just they white, snow kind of look, pale, cool, moist skin, muscle twitching, edema, hypertension, tachycardia, pericarditis, and pulmonary. In a patient with end-stage renal disease, kidneys have lost most of their ability to function. Toxic waste materials build up in the blood. It is pretty much fatal unless treated by dialysis for renal transportation. Correction, transplantation. So you get a renal transplant, basically. So signs and symptoms: confusion, shortness of breath, peripheral edema, bruising, chest pain, and bone pain. As the toxins accumulate, rheumatoid, nausea, vomiting, muscle twitching, and tremors, hallucinations may occur. Lethargia, headaches, cramps, and signs of anemia are in the late stages. Seizures and coma are possible. That uremic frost also develops around the face area. All right, pathophysiology of female reproductive organs. Gynecologic problems are common cause of acute abdominal pain. I always consider that a woman with lower abdominal pain and tenderness may have a problem related to her ovaries, fallopian tubes, and uterus. Pain may be related to the release of an egg from an ovary as part of the normal menstrual cycle. Pelvic inflammation disease is infection of the fallopian tubes and surrounding tissues of the pelvis, intense pains in the lower abdomen, and a high fever. Ectopic pregnancy, 1 to 2% of all pregnancies are ectopic. Fertilized egg implants outside the uterus, usually in a fallopian tube. The fallopian tube can only support growth of the fetus and placenta for about 6 to 8 weeks. Rupture can produce massive internal hemorrhage and acute abdominal pain, generally on one side. Acute abdomen may also be associated with the onset of hypovolemic shock. Pathophysiology of the male genital tract, epididymitis or orchitis. Infection that causes inflammation of epididymitis. With orchitis, the infection causes one or both testes to become enlarged and tender. Swelling may occur and growing on the affected side. The patient will have a fever and the urine will have a foul. Pyrrhosis is a painful, tender, persistent erection. Can result from diseases such as leukemia and tumors, blood cranial trauma, spinal cord injury, and the use of cocaine. Maintain the patient's privacy. Do not make assumptions about the cause of the benign prostate hypertrophy, an age-related non-malignant enlargement of the prostate gland. Occurs in approximately 50% of men older than 60 years. May be asymptomatic, or it may lead to difficulty starting urine flow, slow weak urine flow once started, incomplete emptying of the bladder, and increased urination at night. It always may have urinary retention. testicular masses rarely require pre-hospital treatment. If painful, the pain may radiate up the spermatic cord or be localized to a specific scrotal point. Most are benign cystic masses or varicose. Testicular cancer also presents as a painless, solid lump on the testicle. Alright, testicular torsion, twisting of the testicle on the spermatic cord associated with sudden onset of scrotal pain and swelling. A medical emergency if the twisting of the vessel reduces blood flow to the testes. Torsions may occur with or without blunt trauma, a testicular lump, or blood in the semen. Alright. In older people, the walls of the aorta sometimes develop weak areas that swell to form an aneurysm. The development of the aneurysm, unless acutely dissecting, is rarely associated with symptoms. If an aneurysm tears or ruptures, massive hemorrhage may occur with signs of acute peritoneal irritation and hemorrhagic shock. The patient may also report severe pain to the back, and bleeding usually leads to profound shock. A hernia is protrusion of an organ or tissue through a hole or opening into the body cavity where it does not belong. It can occur as a result of congenital defect has around the umbilical. A surgical wound that has failed to heal properly, a natural weakness in an area such as in the groin. It does not always produce a massive lump. Incarcerated hernias may become seriously compressed by surrounding tissue and eventually compromise the blood supply. In this situation, called strangulation is a serious medical emergency and immediate surgery is required. Common locations for hernias in the abdomen are the epigastric, umbilical, inguinal, and femoral. Serious hernia signs include a formerly reducible mass is no longer reducible, pain at the hernia site, tenderness in the hernia when the hernia is palpated, and red or blue skin discoloration of the hernia. So, in all this, here's how we're going to do your patient assessment. That's just an overview of the many abdominal conditions that can occur in your patients, both male and female. State that de-escalating safety, mechanisms of injury, illness could be the result of violence. Make sure you get your number of patients. If several patients complain of GI syndrome, suspect release of biological chemical agent. Some of those signs and symptoms may be, abdominal pain, nausea, vomiting, diarrhea, and other complaints. Common signs and symptoms of irritation of the inflammation of the peritoneum, local diffuse abdominal pain and or tenderness, quiet patient growing the abdomen, rapid and shallow breathing, referred pain, anorexia, nausea, vomiting, hematemesis, and also a tense, often distended abdomen. Patients experiencing renal or genital problems may exhibit many of the same symptoms as a patient with other abdominal problems. The location of the patient can provide clues. A patient with urologic or renal problems may exhibit extremes of activity. Is the patient constantly changing position in an attempt to find a comfortable position? That's the kidney stone dance. Is the patient sitting very still with the knees drawn to the chest? In some situations, patients are comfortable only with lying in one particular position. One aspect of general impression that is different for GI patients is odor. GI problems rarely affect breathing directly. So ensure your airway is patent, fluctuating quality, as well as skin condition may indicate shock. Check the pulse in both arms because the difference in pulse strength may indicate an aortic dissection. So, expose the patient for and assess for major bleeding and evaluate for shock. It may be caused by hypovolemia or sepsis. So high flow O2, keeping the patient warm and placing the patient in a position dictated by a local person. Orthostatic vital signs do help in assessing for dehydration. So have the patient assume the position of comfort, usually sitting or laying down, take an accurate blood pressure and heart rate, use caution to avoid loss of consciousness, have the patient change position and repeat measurements after a minute or two. With significant loss of fluid within the vascular space, there may be a 10 beat increase in the heart rate or a 10 millimeter per hemoglobin drop in the blood pressure. When you examine a patient with GI problem for gross bleeding, take note of the amount of blood loss. Amount of blood in a toilet is difficult to estimate owing to dilution. Practice volume estimation by pouring amounts of water you have measured onto various surfaces, noting the sizes of the transport decision. Integrate information to primary assessment. Rapid transport patients who have airway, breathing, circulation problems. Patients with suspected internal bleeding or patients with poor general impression, especially pediatric and geriatric patients, because you don't want them to lose a whole lot of fluid. Ensure that the ride during the transport is as general as possible. Pain is often an important finding. Can indicate trauma, hemorrhage, or infection or destruction. So use that OPQRST, mnemonic. Sample, ask about knowledge of vomiting, changes in bowel habits and urination, weight loss, belching, and questions related to specific. The chest pain is reported, you use OPQRST. Ask females about the last menstrual cycle, changes in bowel habits, knowledge of vomiting, urination, weight loss. Are there any changes you have noted recently that may be contributing to your pain? Do not give them anything by mouth and check for secondary assessment. Information may be used to focus on your physical examination of the abdomen. Pain and tenderness are the most common symptoms of acute abdomen. May be sharply localized or diffuse and will vary in severity. Localized pain may give clues to problem organ or area causing it, and in some cases, muscles of the abdominal wall may become rigid involuntarily to prevent abdomen from further irritation. Guarding also, and it can be seen with major problems such as a perforated peptic ulcer or pancreatitis. Patients with peritonitis usually have abdominal pain even when lying quietly. So the degree of the pain and tenderness is usually related directly to the severity of the peritoneal inflammation. All right, in your abdominal assessment, explain the assessment procedure and examination. So if you have a high respiratory rate, normal pulse rate, blood pressure may indicate ineffective ventilation due to pain. Use pulse oximetry and non-invasive blood pressure devices. Always obtain the patient's blood pressure manually with a blood pressure cuff and stethoscope. So, frequent reassessment is vital. Assess vital signs compared with baseline. Reassess the patient. If the patient has GI bleeding, continue to assess for shock. Call paramedic backup if the patient is stable. Do not delay transports with these patients. So do not attempt to diagnose the cause and clear and maintain the airway. Before transport, anticipate the patient is going to vomit, so lay these patients in positions of comfort. Do not give them anything by mouth. Document all pertinent information. Anticipate and treat hypovolemic shock. Document that pertinent information using your OPQRST. So establish an IV and give a 20 ml bolus. Isotonic corticosteroid the patient presents with signs of hypovolemia. Otherwise, maintain fluid at a acute vein open rate. The patient does have a UTI kidney stones and kidney function is present. Administer a bolus of fluid. Before transport, make the patient comfortable if possible, monitor vital signs, and which may change quickly, and consider for cardiac. In pelvic inflammation disease, pain may be intense and accompanied by high fever. Transport to the ED immediately. In pneumonia, may be caused both ileus and abdominal pain, inflammation response to the abdomen. Acute signs and symptoms of shock could signify an aneurysm. This does require prompt transport and avoid unnecessary and vigorous palpation of the abdomen. So, only administer fluid if the hypotension and symptomatic. In a hurry, transport promptly to the emergency department. Acute kidney disease can be lead to life-threatening emergency. Support ABCs is imperative. Build up the possibilities of hypertension and pulmonary edema, and provide emergent transport and supportive care. Renal dialysis is usually only dependent treatment for end-stage renal disease. Patient's blood is filtrated and cleansed of toxin, so it goes back to a normal blood chemistry. So there's two different types of dialysis: peritoneal dialysis and hemodialysis. Peritoneal dialysis is large amounts of specially formulated dialysis fluid are infused into and back out of the abdominal cavity. So the fluid stays in the cavity for 1 to 2 hours. It can be very effective, but high risk of peritonitis. Okay, give me 1 minute. With proper training, it can be performed in the home. In the hemodialysis, the patient's blood circulates through a dialysis machine that functions much like normal kidney. Patients connected to a dialysis machine through a shunt. Other patients have a small button-shaped device called a hemocyte. It has a rubber speculum. Can be punctured with dialysis meters during treatment. Some patients have an internal shunt, such as a AV shunt, which is the artificial connection between a vein and an artery. In these patients with a life-threatening emergency, the internal shunt may be used for IV access. These patients usually go long-term dialysis, go on the machine every 2 to 3 days for a period of 3 to 5 hours. If the patient does have a machine problem, the patient will know a lot more about it than you do. Always ask the patient what has been done before you arrive. All right. So adverse effects and complications: hypertension, muscle cramps, nausea, vomiting. So hemorrhaging from that site can be very fatal. So be cautious of that. And a lot of these patients do have electrolyte imbalances if they do not get their dialysis on a regular basis. And then they also present with myocardial ischemia. Sudden drop in blood pressure is not uncommon during after dialysis treatment. Electrolyte imbalance may develop, consider possibility of cardiac arrhythmias and the need for ALS backup. Shock and secondary to bleeding is also possible for many normal cases. The patient misses a dialysis treatment, weakness, pulmonary edema, excesses of electrolytes will develop. There ain't nobody about that. Okay, these patients, when they miss treatments for consecutive times, they do become acutely sick. It can, if call involves patients receiving dialysis, start with ABCs, be alert for leaking shunts, and many dialysis patients have a urinary catheter. Make all attempts to deliver the patient to a hospital with dialysis capability. if these things become disconnected at the vein, clamp the cannula and disconnect the patient from the machine. In a suicide attempt, the patient may open up the cannula. If you encounter a situation, immediately clamp off the cannula and apply direct pressure. This disequilibrium syndrome. Water initially shifts from the bloodstream into the cerebral spinal fluid. This mildly increases intracranial pressure, characterized by nausea, vomiting, headache, confusion, after fluid will equilibrate between the blood and cerebral spinal fluid. So, and the patient's own symptoms will improve on their own. Air embolism is any other fitness connection in the dialysis system or loose air may enter the system, producing an air embolism. Symptoms include sudden dyspnea, hypertension, cyanosis. So disconnect the patient from the dialysis machine. And this is the end of this chapter 20. Unless trauma is involved, expose and assess the abdomen. So ask the patient where the pain is most intense. Palpate in a clockwise direction, begin with the quadrant after the one the patient indicates is tender and painful. End with a quadrant patient indicates is tender and painful. And because if you palpate the most painful area first, the patient may guard against the triple A's, of course: kidney stones, kidney infections, pneumonia,